Hello, my name's Carlin Calloway. I'm a nurse practitioner at the University of Colorado Cancer Center in Aurora, Colorado, and I'm honored to talk to you about Thriving After Active Colorectal Cancer Treatment, Life After Cancer, a webinar by Fight Colorectal Cancer. I have no disclosures, and my email address is listed on the slide. Feel free to email me if you have any questions or if there's anything I may do for you. So the goals and objectives of the time that we have together is to define survivorship, explore colorectal cancer screening schedules, review healthy wellness tips, discuss when to call primary care versus your oncology team, and discuss care coordination. Survivorship is a concept that has been around since 1985, so that's roughly 35 years. A physician wrote an article in the New England Journal of Medicine, and a few months later worked to found the National Coalition for Cancer Survivorship. This is a terrific organization, and I encourage you to check it out online. Over the years, the Institute of Medicine has published many key works about survivorship. The most notable one was written in 2005, entitled Lost in Translation, From Cancer Patient to Cancer Survivor. There were 10 goals of this document for healthcare providers and people affected with cancer to continue to improve upon over the years. Those 10 guidelines include: number 1, increase awareness of cancer survivorship. Number 2, provide a cancer survivorship care plan to survivors. Number 3, develop survivorship clinical practice guidelines. Number 4, define quality care for survivors. Number 5, overcome healthcare system challenges. Number 6, acknowledge that survivorship is a public health concern. Number 7, educate healthcare professionals. Number 8, address employment-related concerns. Number 9, improve access to health insurance. And finally, number 10, invest in research. Fast forward 15 years, the National Comprehensive Cancer Network is continuing to lead the way with the American Society of Clinical Oncology for survivorship care. The NCCN defines a survivor as somebody who's been diagnosed with cancer, and this continues throughout the duration of their hopeful long life. The diagnosis of cancer impacts many people. The NCCN also believes that diagnosis and treatment have persistent impacts in one's life, and that their guidelines should be applicable across the entire continuum to the point of death many years after diagnosis. There are 6 standards of survivorship care. These include prevention of new cancers, surveillance for recurrence, assessment of side effects, intervention to help with side effects and late effects, care coordination, and planning for ongoing care. According to the American Cancer Society in 2020, an estimated 606,000 people will die of cancer this year. That is an overall decrease from 2019. However, there has been an increase to 1.8 million new cases of cancer that are estimated to be diagnosed this year. 80% of new cancer diagnoses are expected in adults over the age of 55. And as of January 2019, there were approximately 17 million Americans living with histories of cancer. This slide illustrates the type of cancer, the number of anticipated new cases in 2020, and the estimated deaths in 2020. So for colorectal cancer in the middle of the screen, approximately 105,000 people will be diagnosed with colon cancer, and 43,000 will be diagnosed with rectal cancer. Also, 53,000 Americans are anticipated to pass away in 2020 as a result of colorectal cancer. In terms of survivorship and cancer, we know that cancer is primarily a condition that impacts older adults. And in the literature, this has been described as a silver tsunami. We know that approximately 70% of people live more than 5 years after they've been diagnosed with cancer, and approximately 50% live more than 10 years following their diagnosis. We also know that approximately 20% of people will live more than 20 years following their diagnosis. In 2040, we estimate that 26 million people will be living with histories of cancer. Many people ask me if they should call themselves survivors and what that term means. Survivor is an individual concept. You need to decide what that word means for you. It is a label and it has meaning, like fight or warrior. Some people describe themselves as thrivers. Many people wonder if the cancer experience defines themselves or if it's a chapter in their life. People also question the cultural implications of being called a survivor. Ultimately, it's your choice what word you choose to use. Many people also ask if they have been cured of cancer, and this is a complicated question. The literature would say that one is considered to be cured if they have the same mortality in terms of age and sex as somebody in the general public who has not been diagnosed with cancer, and that these individuals who are cured should have the same routine surveillance for other types of cancer. Healthcare providers believe that being cured is the gold medal for finishing treatment. So sometimes a surgeon may finish a case and say, we got it all, we're done, we took care of it. Other healthcare providers acknowledge that cancer is a chronic illness, and another group don't want to raise false hopes. Patients want to know if they're cured, but it's a terrifying question to ask. The answer may be exciting, but the unknown, again, can be terrifying. So this is a challenging topic. I tell patients that their healthcare team has treated them with the maximum safe tolerated dose of treatment to put this in the rearview mirror based on many, many brave people who've come before them and participated in clinical trials. Colorectal cancer screening is a very individualized concept in 2020. For the general population, the American Cancer Society recommends that screening begin at age 45. The National Comprehensive Cancer Network believes that screening should begin at age 50. However, it is challenging for some people within the age 45 to 50 bracket to have screening colonoscopies covered by health insurance. We know that people who have completed curative treatment for colon cancer receive colonoscopies 12 months after their surgery. People with a family history should begin 10 years prior, and then people with specific genetic conditions such as Lynch syndrome or people with high-risk polyps should be screened according to specific guidelines. Please talk to your individual healthcare team about what is best for you and your family. It is very important to discuss survivorship. We know that people are living longer and they're living better having been diagnosed in the past with cancer. A cancer diagnosis impacts oneself and one's family and friends in 5 specific domains. Physically, people may have side effects such as fatigue or nausea or neuropathy. Emotionally, people may wonder, what this diagnosis means for their ability to contribute to their family. It may it may impact their ability to connect with friends. It may make them sad that they're not able to do the things that they used to do. Spiritually, some people wonder why they're going through this experience. They may question God or their spiritual beliefs about their diagnosis. And lastly, but certainly not least, a cancer diagnosis has financial implications. Consider a young adult diagnosed with cancer who needs to make decisions about paying for treatment versus investing in their retirement or paying their bills or going to college. Consider the person who's been diagnosed with diagnosed with cancer who's unable to work full time because of side effects such as neuropathy. Survivorship is on the continuum of quality oncology care. When one is first diagnosed with cancer, tremendous effort and attention are paid to the diagnosis. There has to be a biopsy. Many healthcare professionals collaborate to determine a plan. Patients sign a consent and hear terms that they may never have heard before. Many patients have a central line catheter or Metaport placed. And then they meet with members of the healthcare team for teaching about chemotherapy, biotherapy, or immunotherapy. Treatment in 2020 is multimodal. Many people receive chemotherapy, surgery, radiation. They're treated by interventional radiologists, and their palliative care, integrative medicine, and supportive oncology teams also help to contribute to positive outcomes. When treatment is done and people do not have healthcare appointments every 2 to 3 weeks, they then enter the survivorship phase where they are working on trying to go forward with their new life after a diagnosis. In this chapter, so to speak, integrative medicine, palliative care, supportive oncology, and their oncology teams continue to be important. This is an awkward time for many. People describe it as confusing. They feel vulnerable. They feel at a loss. They think their healthcare team may have abandoned them. They don't want to be a burden and call and ask questions about side effects. When will the fatigue end? When will the neuropathy improve? So it's important for people to know that these feelings are normal and that they are not a burden on their healthcare team. Their healthcare team continues to be available to answer questions, provide reassurance, and help them go forward. There are 11 categories that we consider when talking to somebody who's completed treatment. In 2020, we have learned a great deal about the implications and effects of treatment on one's heart. At this time, there are no known direct complications on one's heart from known standard of care chemotherapy treatment for colorectal cancer. However, in the coming years, we may discover new implications for cardiac health. We want to make sure that people have their anxiety, depression, and distress acknowledged during this time. We want people to feel like the fog from chemo brain lifts, and we work to provide testing and interventions to help people have clear thinking. We know that fatigue is the most common side effect and that fatigue may linger for years. Depending on surgeries, lymphedema is possible. Some people who are perimenopausal may be pushed, if you will, into menopause as a result of receiving chemotherapy. Some people have pain following surgery or have pain or changes with ostomies and new appliances. Most people wonder about sexual function and intimacy and restoring relationships that may have been on pause during treatment. People may or may not lie awake at night and toss and turn and wonder about the future. People may also use this as a time to think about making healthy lifestyle choices. Several people ask about diets and supplements and what they should be taking. And of course, immunizations. People may or may not have received immunizations while they were treated for cancer, and it's important to acknowledge that immunizations are important for preventing specific conditions. As somebody who's been impacted with cancer, it's important to tell you that people who have been diagnosed with cancer may be at increased risk for high blood pressure, high cholesterol, weight gain, and high blood sugar. We don't necessarily understand the cellular pathways for these changes, but there's some thought that cancer accelerates the aging process. We also don't necessarily know if it's the diagnosis or the treatment that may change these values. Because the goal is to live as long as possible as well as possible, it is important for people to establish or continue care with their primary care team regularly and have an annual physical exam with blood tests. Anybody who's been diagnosed with cancer should achieve and maintain a healthy lifestyle. This includes addressing dietary habits, physical activity, and weight management. We do know that weight gain is associated with increased cancer risk. We also know that people who do their best to adopt healthy lifestyle habits have improved overall health and quality of life. It is important to reiterate that chronic health conditions such as heart disease, diabetes, and weight gain impact outcomes. Everybody should be encouraged to do the best they can with a fresh start every day. Every day is a new opportunity. People should be encouraged to maintain a healthy weight by adjusting diet and exercise. People should eat diets high in vegetables, fruit, and whole grains, with less emphasis on red meat, processed meats, sugars, and fat. Of course, one may splurge and enjoy an extra piece of cake or have a glass of wine, but overall, one should seek to strive to have a healthy diet. Nutrients should come from food sources rather than dietary supplements. It's best to eat a colorful plate full of many vegetables. Exercise is key. It is recommended that people who have been diagnosed with cancer exercise at least 30 minutes a day, 5 times a week. This may include stretching. This may include walking from the back of the parking lot, taking the stairs, vacuuming. Just move muscles. In recent months, we are learning a great deal about sedentary activities and how they impact outcomes. So the best advice is to balance sedentary activities such as watching television with sound exercise and nutrition. Set time limits for how much TV you watch. Have a plan during commercial breaks. Think about how you can balance both without one activity dominating the day. In the next decade, I think we will continue to hear more and more about exercise as medicine. The American College of Sports Medicine really does believe that exercise is medicine. They have done several studies that talk about the positive impact of exercise. Recently, their work has helped us learn that exercise helps to prevent 7 types of cancer, including colon cancer. They've also helped us understand that exercise improves survival of 3 types of cancer, including colon cancer. And there's considerable evidence that exercise helps with 8 key factors. Exercise will help eliminate cancer-related fatigue, improve quality of life, improve physical function or the ability to do the things that matter. Exercise will also reduce anxiety, depression, lymphedema, improve bone health, and improve sleep. If exercise was available in a tablet form, everybody would want it. So there's no time like the present to do some sort of physical activity. Stand up, stretch once an hour. Think about parking at the end of the parking lot. Think about taking the steps. Yes, vacuuming counts. Move muscles. Besides exercise, it's important for people with histories of cancer to practice sun safety. In Colorado, where I live, melanoma is diagnosed at increasingly alarming rates. Please use sunscreen, wear hats, wear long sleeve shirts, avoid sun exposure during peak times of the day, and be mindful of the need to reapply sunscreen. If you don't smoke, please don't start. Tobacco, whether it's in the form of cigarettes, chewing tobacco, or e-cigarettes, can have significant consequences. There are resources available to help one quit. If you drink alcohol, limit the amount of alcohol that you drink. For best outcomes, women should consume no more than 1 drink per day, and men should consume no more than 2 drinks per day. We do know that the overall cancer rate is higher in people who have been diagnosed with cancer than in the general population, so it is important to continue routine screenings. Women should talk to their healthcare providers about mammography and GYN screening. Men should talk to their healthcare teams about prostate cancer screening. For those age 55 to 80 with a 30-pack per year history of smoking, who have quit within the past 15 years or who currently smoke, they should be having conversations with their healthcare team about screening. Lung cancer screening is now readily available, and if caught early, lung cancer has good outcomes. We need to do better with screening people who are eligible for lung cancer screening. Immunization should be discussed with your primary care team. Your primary care team is very good at managing cholesterol, blood sugar, blood pressure, immunizations, preventative health, all those key concepts that will help you live as long as possible, as well as possible. Flu vaccine should be encouraged. It does take about 2 weeks for it to become effective, and the shot is usually recommended as opposed to the nasal dose. Adults, both men and women under the age of 45, should have the HPV vaccine. This vaccine is helpful for reducing the risk of cervical cancer, anal cancer, and head and neck cancer. Additional recommendations from the Centers for Disease Control are available for tetanus, shingles, and pneumonia vaccines. Again, your primary care team are the experts when it comes to your immunization schedule. During treatment, people may or may not have maintained their dental hygiene visits. So following treatment, it's important to contact your dental office and make an appointment for periodic dental cleanings and exams. Now more than ever, it's important for people to discuss advanced care planning. Who is going to pay bills in the event that you are unable to do so? Who is going to make medical decisions for you when you are unable to do so? Again, while we hope those are many, many years from now, We do want people to take time now to think about making sure that their wishes are known. It is very important for people to contact both their oncology teams and their primary care teams if they notice a symptom that lasts more than 14 days. If there's ever any doubt, please pick up the phone, send a message, contact your team in whatever methods are established and preferred, but do not feel discouraged. I tell patients that healthcare teams get paid to handle their concerns and questions. So rather than lie awake or worry, it's important to speak up. Your oncology team doesn't want to hear about something that began 3 or 4 months ago. They'd rather help you feel better sooner rather than later. There's no such thing as a silly question. Again, please speak up. Care coordination is an important aspect of survivorship care. Communication is challenging. Medicine is complicated. People move and change doctors. So how do we make sure that your primary care team, oncologist, endocrinologist, dermatologist know about your health care? There are many additional resources for people who have been diagnosed with cancer or who are impacted with cancer. I encourage you to look at the American Cancer Society, the American Society of Clinical Oncology, the National Cancer Institute, the National Cancer Survivorship Resource Center, National Cancer Survivors Day, Office of Cancer Survivorship, and to help with care coordination, as previously mentioned, OncoLife will help provide survivorship care plans to those who are interested. Of course, Fight CRC has terrific resources. Please refer to the websites listed on this slide for information about life after treatment and surveillance, survivorship, and mindfulness, or dealing with all of the stress that one may experience as a result of a diagnosis. Thank you.